And in the studio to talk about the revitalization of primary health care and matters arising is the Chairman, Senate Committee on Health, Senator Ibrahim Olorogbe. He's joining us via Zoom. Okay, right here in the studio is Dr. Isaac Egboja. He's a public health specialist. You're welcome to Weekend File.
Thank you very much. Thanks for inviting me.
Yes, we had some positive, reports from the DG of Primary Health Care, Dr. Faisal Shaibu, but it's not yet Uhuri. So what are the indicators for evaluating this primary health care, and what is the current state of the over 30,000 primary health centers in Nigeria?
Well, the original plan for primary health care centers is that the federal government would establish them, construct them. The state governments were supposed to equip them, and the local governments were supposed to provide the staff to man them. In this regard, when you are looking at primary health care center, you'll be looking at the infrastructure, the structure itself, the buildings and so on. And then you'll be looking at the staff that are there to render services. And of course, the equipment and drugs with which the services would be rendered. Those are the three basic things that you'll be looking at.
Okay, the three basic areas that we'll be looking at. Now, there must be, barriers, to a functional primary health care system. This is something that has bothered a lot of Nigerians, not getting enough, doctors, nurses, and support, attendants at the primary health centers. And is it a different story now? Do we have more personnel that can attend to people at the grassroots? Not really.
That is still a problem. You just listened to a report of the one in Kuchungaro, very close to Abuja here. That one is functioning well because there are a good number of staff, well trained. The services are always rendered 24 hours around the clock. The equipment with which to work are provided, and therefore that one is functioning very well. And that is the ideal situation or a model for all the others around the country. Ideally, there should be a minimum of one comprehensive health center per council ward. And we have 774 council wards around the country. The number when I say minimum, I mean one per ward. There should be more than that because there are many wards that are very large. The distances are also very large and therefore difficult for people to travel. Ideally, people should be able to have a health center within a radius of 5 kilometers from them.
Okay, now one issue at the core of the primary health, care centers in Nigeria is the maternal mortality rate. Women not getting access to nurses or doctors during delivery or during pregnancy, and they end up going to quack, doctors to treat them. And out of 13 women that give birth every day, at least one is lost to maternal mortality. Is the story changing? Is the narrative changing now? Are they getting more access?
Well, yes or no. While in some parts of the country the situation has improved a little bit since the 80s, when the idea of National Primary Health Care Agency was conceived. However, in some other parts of the country, the situation has not really changed that much. And we are still recording undesirable number of maternal morbidity and mortality. And that is also accompanied by infant mortality too. Well, let me start like this. The idea is that for basic health care, for simple ailments such as malaria, normal pregnancy, and so on, everybody should be able to access a primary health care. A woman who suspects that she's pregnant should be able to go to a primary health care near her and carry out a test to ascertain if she's really pregnant. And if she is, she's supposed to be regularly, at least once a month, going to the primary health care near her to be checked. And where there's a suspicion or a confirmation of problem, that woman would then be referred to the second level of health, which is secondary health level, which is what we call here general hospitals. And when the problem is more than that level, then it might have to go to a tertiary level, which is the federal medical centers, the teaching hospitals, the specialized hospitals that we have around the country, both public and private. But unfortunately, because of the absence or the inadequacy of primary health care centers around the country, many women don't even have access to basic care. And when they are taken to a hospital, sometimes it is late. They were not seen during pregnancy, or they were seen late into the pregnancy, and therefore the basic things that they were supposed to have been done, they were supposed to have done, had not been done, and therefore the conditions sometimes become so serious that they may lead to death, which is unfortunate. At the moment, we are recording about 800 deaths for every 1,000 live births. And that is a lot of figures. In other words, we are saying for every woman that goes, say, 10 women that go to or get pregnant, one of them will die from a related problem to pregnancy and delivery.
Indeed, that is one area that needs a lot of working on by the health sector itself and stakeholders in the health sector. We'll get to talk more about other issues or matters arising after this break. We'll be right back. Now, you're welcome back to the conversation segment, and we do sincerely apologize. Senator Ibrahim Olerugbe, Chairman, Senate Committee on Health, cannot join us. The bane of technology, the Zoom isn't working well, and we do apologize for that. My guest, Dr. Isaac Egboja, public health specialist, is still seated in the studio. Let's go back to the issue of personnel for primary health care. And I know that the issue of brain drain has really affected the health sector in Nigeria, the JAPA syndrome that I know as we call it. How is it affecting primary health care in Nigeria?
Well, we talked earlier about manning the primary health care centers. There's no use building a structure if nobody is there to give the services or render the services. In an ideal primary health care or comprehensive primary health care center, there should be at least a doctor and a good number of nurses, laboratory personnel, pharmacists, so that each person will be rendering his or her own part of the service. But at the moment, we have very few number of health centers that have doctors attending to patients there. And recently, unfortunately, many young Nigerian doctors are leaving the country for greener pastures, and therefore what we already had as a problem has now increased rather than decreasing. And this is rather unfortunate, because this is the time when we are working towards universal coverage of healthcare around the country. And this is not the time for us to lose trained doctors to other places. Normally, because of the lack of infrastructure in rural areas, many health personnel are not comfortable working there, and therefore when they are posted by states or by local governments, they are reluctant to go there. And we are preaching to people that, first of all, at the government level, to try to make the services there attractive so that doctors and nurses will be willing to go there. And when we are working on that, people are leaving the country, nurses are also leaving the country. It compounds the problem that we have at hand.
Okay, talking about revitalization, it is not just only about infrastructure, it also includes the right equipment, medicine, water, electricity, health personnel, and housing to provide 24-hour services to the people. Do all this exist now with the revitalization of the primary healthcare system?
Certainly not. That's exactly what I just said. In terms of infrastructure, we don't have enough. In terms of personnel, we don't have enough. In terms of equipment, we don't have enough. In terms of drugs, we don't have enough. You recall that some years back, we even started what we called the drug revolving scheme, meaning that you supply a certain quantity of drugs to a particular health center, they dispense them to their patients, collect money from them, use the money to buy other drugs so that there's always drug available in their pharmacy.
Okay, quickly before we go, what does the primary health care need to receive the attention of, from the stakeholders, both the private sector and the public sector, quickly before we're running out of time?
Functionality. They need to be functional and effective. The moment they are effective and they are functional, affordable, accessible, people will patronize them and people will be encouraged to support them.
So we've been able, through this, the revitalization of the primary health care, to achieve the development goal here in Nigeria. Is that a possibility that we have achieved it? The SDG development goal?
Yes, for us to achieve the goals, there needs to be a lot more primary health care centers, and we need to train more people to man them. We need to equip them. We need to provide them not only with equipment but also with drugs, so that these services are accessible and affordable to those who need them.
Okay, Dr. Isaac Egboja, public health specialist, thank you so much for coming on Weekend File. It's been a pleasure having you.
My pleasure. Have a great evening.
We'll take another break now. When we return, we'll begin to round up.